I've been in practice for about 4 years. I never in my wildest dream would have expected that we would have a pandemic like this that has essentially shut down surgery everywhere in America. And it just really made all of us sort of hit the reset button.
Completely agree. I've been in practice for 2 years, and every now and then you might have a case get canceled for whatever reason. But experiencing a pandemic like this that affects the whole world, as well as the US, and then, in Texas, not being able to do any elective cases and having a hard time even getting other cases on the schedule, it's the longest that I've been out of the OR.
I'm still operating, I'm doing trauma, but obviously the elective surgery has gone down. Surprisingly, there are some hospitals here in Orlando that have been criticized for allowing elective surgery to go on somewhat at the discretion of the surgeon, but that has sort of been curtailed. The surgeries that I'm doing right now relate to basically trauma of the face and upper extremity, so fractures, lacerations, or infections. But the elective surgery has essentially, as Raja has said, has been cut off in Texas. It's certainly been cut off here now in Florida. So I'm looking forward to going back and doing some cosmetic surgery, whether that's facelift, eyelid, or breast augmentation. All of the patients that I had scheduled prior to the COVID have certainly been canceled, and we'll have to get them back on the books, but returning back to the operating room to do aesthetic surgery is going to be fun.
And for me to echo some of those points, I also take call for hand and facial trauma. I was on call the last week of March. I felt that the hospitals here was a little bit slower. I think that a lot of the people are afraid to go to the hospital unless they absolutely have to. And then I'm on call again later at the end of this month, so we'll see how it is during that time. But yeah, I also canceled all my elective cases, and I'll have to get those back on the schedule. I think tough thing for me is I also do a lot of wound reconstruction, just general reconstruction. I've had to put those patients off because they're considered elective. I'm not really used to that. I'm used to seeing them in my schedule, in clinic right away, getting them on the schedule. I don't really have to wait. Anyway, I think the thing for me that I'm looking forward to is just getting back to my normal routine, going to clinic, going to the OR. It's been good and bad. I think the good is I've been spending a lot of time with family and my daughter. The bad is it's just not something I'm used to as a surgeon, just sitting around and trying to think of things to do.
The team that you're used to, I probably like Raja operate in a surgery center, and I don't think probably for another 6 to 8 weeks will we see that team again. And we're working probably at the hospitals because the surgery centers have essentially closed down, and the hospitals, it's always a different crew, and they're trying to make ends meet with different staff to get their checks. So in short, I don't think we'll see, at least in Florida, I think we're going to see a surge in the next 2 weeks. So I think that the closest we'll be able to see our elective cases back on the circuit probably 6 to 8 weeks. And I still think that a lot of people will have fear coming out of their house, going to a hospital or a surgery center for whatever it is. So I think it will be a gradual ramp up back to normal.
Yeah, I agree. I think it's going to take some time to get back to the way things were. I would say in terms of my team, I work with a lot of the same assists, and a few of the hospitals and surgery centers I go to, I work with some of the same people. I've talked to them, and what they've told me right now is they're either not working or working considerably less hours. So similar to me, they're looking forward to getting back into a normal routine or a normal schedule. I think in a way it's good. I guess every area of the country is different. In Texas, they've been very careful, and the hospitals are, and thankfully with COVID-19, they're not that busy. They don't have that many cases, and so a lot of the staff is working part-time or only working a few hours a week. So they're all looking to get back into the swing of things this summer.